Hi, I'm Dr. Matt Rasmussen with Periodontics and Implant Dentistry of Tallahassee. We've been hearing more and more questions regarding different types of gum grafting, when it's needed, and why, so I wanted to take some time out to do a quick video to address some of the most common concerns. A gum graft is a procedure that's done to improve the quality of gum tissue in a particular area around the natural teeth. With some of the procedures as well, if too much of the root is exposed, we may have the opportunity to cover up part or all of the root as well. There are many different types of gum grafts available. Some are indicated in certain situations, whereas another treatment option may be more ideal for another situation. The most common types of gum grafts that you'll hear about are where gum tissue is taken from the roof of the mouth. The two common types that are used with that material are something called a connective tissue graft, as well as another type called a free gingival graft. And again, there are also substitute materials available as well that we use for different procedures. A connective tissue graft is a procedure where tissue is taken from the roof of the mouth that's going to be used to thicken and improve the quality of the tissue at the recipient site, the area where the tooth has too much root exposed. During this procedure, we're going to lift the gum tissue in a way so that less of the tooth is going to be exposed where quote-unquote recession has been in the past. Again, with the goal of this procedure being to cover the root of the tooth and to thicken the quality of tissue of the area. A free gingival graft is a procedure where gum tissue is taken from the roof of the mouth, but because of the location and the anatomy of the area, it's not ideal for attempting to gain root coverage. So the goal of free gingival graft is specifically to thicken the quality of gum tissue to prevent tooth loss. Gum grafting is recommended when there's a couple of criteria present. One or many conditions can cause the gums to recede or to pull back off of the side of the tooth, which means both the gum and the bone tissue that's sitting on the front of the tooth is now gone. In addition to that, if there's not great quality gum tissue in the area, those two concerns or criteria would be used to make a diagnosis for the need for a gum graft. Anytime that we have the opportunity to save a natural tooth, that's always going to be our goal. When gum recession and its associated conditions continue to get worse, unfortunately, the likelihood of that progressing and us eventually losing a tooth increases. So the advantage of us performing the gum grafting procedure is to stop the gum recession in its place to prevent tooth loss. If we can gain a cosmetic result from part of the root being covered as well, that's of course ideal. But the primary goal of gum grafting is to thicken the quality of tissue so we can save a natural tooth. There are a number of steps involved in the clinical procedure of connective tissue graft. Once the patient is numb and comfortable, we're going to open the area up that's the quote-unquote recipient site, basically the area that's going to be receiving the graft, and get that ready. We're going to take the gum tissue from the roof of the mouth, that's on its own separate process, and then the new tissue that's going to be put into the recipient site is going to be placed, and then everything will be closed into place so we get an ideal result. A free gingival graft is a procedure that's also involved with many steps. The first step is going to be to get the recipient site ready. So we're going to be preparing the tissue for the new location where the gum graft is going to go. Once we remove tissue from the roof of the mouth, we're going to place the gum tissue down below where the actual recession is, which is going to allow the new gum tissue to sit below it and sit as a protective band to prevent any future gum recession. When it comes to gum grafting, there's many options available. Only the periodontist treating the patient would make the correct call for what's needed for that particular situation. I'll try my best to go through some of the specifics here, but keep in mind that everything is case specific. Generally speaking, we have two ways that we can go when it comes to the choice of material that's going to be used. I'll mention that because of postoperative pain. The first option, and usually the ideal option, is to use the patient's own tissue, commonly referred as palpable tissue. The procedures for this are a connective tissue graft or a free gingival graft. But in both of those scenarios, we're using the patient's own natural tissue that's going to be used to thicken the area. Now, there are times where we can use alternative materials as well in a similar procedure. The advantage of this is the postoperative discomfort is less. We don't have a donor site where we have to take tissue from. However, in some circumstances, someone's own natural tissue is a more ideal fit for the area. It really depends on the clinical situation and talking with the doctor to know which option is right for you. When it comes to postoperative healing after a gum graft, specifically from the palate, the most significant postoperative pain is within the first week. We will provide a stent or an area that will cover the graft from the roof of the mouth to allow the patient to have simpler postoperative experience. Usually the postoperative course is more simple for someone that's having fewer teeth involved. If someone's having more teeth involved, then it's going to be more sore. Fortunately, when a patient uses non-palatable tissue, the postoperative course is typically very easy. Many times there's not significant postoperative pain involved. The only disadvantage will be that sometimes any sutures in place may be placed there for a more extended period of time as the tissue takes longer to integrate into the area. Gum grafting is a procedure that is meant to be completed in area one time. So it's not a procedure that is going to be meant to be done every 3 years or 5 years, or something that's like on a subscription, like you would think of with something that has a tendency to wear out. So it is intended to be a one-time procedure. However, as with anything in the human body, if an area needs to be grafted in the future, we can always address those needs at indicated sites if needed. There are many financing options available with gum graft. If a patient has dental insurance, we can certainly look into the dental insurance to see if there's any benefit associated with it. Some plans may cover a portion of the procedure. However, there almost will always be an out-of-pocket portion for the expense of the procedure. procedure. And of course, the cost of the procedure will depend on the number of teeth having the treatment. If the patient needs financing options available, please know that there's multiple vendors we can work with that allow us to spread payments out over a period of time. When you're ready to talk further about getting a gum grafting procedure done, please feel free to call us at area code 850-692-9200 to take an exam with the doctor and to see what opportunities are available for you. Know that we can certainly see you as a patient with or without a referral. So if you just have questions on your own, we're always happy to see you to see if gum grafting is indeed an indicated procedure for you.